As you're walking down the street and you inhale the smoke of a cigarette, do you realize that it is bad for your health? Or maybe you are that smoker. Did you know that you are harming the health of surrounding people? In 1988, the Surgeon General announced that cigarettes and tobacco products were addicting, and that the addiction was caused by the substance nicotine. Tobacco products today are seen around the world as bad for our health. Nicotine dependence can be referred to as not being able to stop using the substance. Nicotine dependence has many effects on our overall health and can have many outcomes that affect our physical health. It can be very beneficial to decrease the amount of nicotine used. Today, we wonder, what is nicotine dependence, or how is it bad for our health? Well, according to the medical news today, nicotine dependence is an addiction to tobacco products caused by nicotine. It is also said that it is one of the hardest addictions to break. Tobacco products such as cigarettes, chewing tobacco, snuff, pipes, and cigars all contain the substance nicotine. But the most commonly used tobacco product is cigarettes. Over 1 billion people smoke worldwide. And according to the American Heart Association, 23% men and 18% women smoke in the United States. So you're wondering, what are these symptoms of this nicotine addiction? Some of them can be smoking and cannot stop, withdrawal symptoms from this nicotine, continuing to smoke despite health concerns, and social sacrifices. Some physical outcomes that we know are of cancer, heart disease, emphysema, stroke, and many more. But not only physical, but as well as psychological factors affect this addiction. Cues and behaviors like certain moments or certain places or people can trigger this desire to smoke. And if they don't have this nicotine in their bloodstream, it can cause a withdrawal. Withdrawal symptoms can be a drop in mood, anger, anxiety, or problems focusing. And until they have this nicotine in the bloodstream, they will continue having these symptoms. Benefits from quitting can be worth the while. Your overall health can be really increased, and risks are practically increased from like 50% to at least 75%. Heart rate slows down after you eventually quit. Your lung function improves significantly. Carbon monoxide levels are back to normal at least within a day. I could go on with these benefits, but you have to have that thought of wanting to quit. Many people nowadays have family members that are tobacco users or smokers. My grandfather used cigars, and he eventually died a few years ago from the cancer leukemia. Now, these may not be connected, but the nicotine probably affected his overall health, like I said, and it eventually caused this cancer, leukemia. There could have been times where he did not use it, and it improved his health and could help fight this cancer. And many people have these problems today, and there will always be in the future too. So do not only quit for yourself, but quit for those family members and friends that are caring for you and are wanting you to have the best. So, like I said before, using nicotine can cause your health to automatically decrease and is not good for those people around you. There are many services that can help you quit. Beneficial services like hotlines, counseling, medicines, patches, and like nasal spray and many other things that are out there can help you. The most effective way to quit is both counseling and medication. Most of the time, people do both, and they're both helping to overcome this quit. And there's a small percentage of people that quit annually. So once again, don't be the person to become nicotine dependent, or if you already are, find that reason to quit.